Hi, I'm Dr. Rudy Cashman. Thanks for watching our show. You know, we do these regularly. You can look at our website too, cashmanhealth.com. I give lectures regularly at Lutheran Hospital about once or twice a month, all about wellness, health, nutrition. I was in physician, almost 50 years now, and I found that I could get the majority of patients, frankly, well through lifestyle teaching, exercise, besides being a busy neurosurgeon. The last show we had was on nutrition and breast cancer, just aiming specifically and focusing on that. Very interesting, and I hope you had a chance to watch it. If not, it'll be on YouTube eventually in a couple of weeks. What I said there, really, and I like to say it again, 50 to 70% of our breast cancer is avoidable through proper nutrition and lifestyle and nutrition. The Mayo Clinic book on breast cancer, excellent book, has it listed on a couple of pages on there. I mentioned them on the last show, that obesity is related to 50% of breast cancer. I mean, that's a fantastic opportunity when you think today 90% of breast cancer can eventually be cured with chemo, radiation, genetic therapy, things of that nature. But just think of the disability and suffering that many women have to go through. And I read here just over this weekend, although 90% cured by surgery, radiation, and other methods, their lifespans are cut short, about 19 years on the average. They develop other cancers from the chemo and radiation, things of that nature. Very interesting. So let's going on this trip. I laid out here about a whole bunch of books for you, to which I'll hold up, which I recommend you read, because we lack information. I tell the majority of us we must participate in our health care, and trying to get you to participate in your health care by seeking knowledge, watching the show, looking at internet sites, consulting with a physician, getting other opinions. It's about open-mindedness. I'm just trying to educate you, and you choose to do what you wish to do. The incidence of cancer, around 1900s was about 3%, but now about 42% of the people in their lifetime in the United States can expect to get cancer. Yeah, 42%. And I'd like to, in this good hope though, in this good news though, because 50 to 70% of that can be avoided. Only about 10-15% is genetic, that you can do very little about it. But the majority is due to our lifestyle, what we're eating, toxins we're exposed to, what habits you have, what you put in your fingers, your forks, and how you use your feet. I mean, it's very interesting. Also, though, gives us a great opportunity. David Schneider wrote a book called Anti-Cancer, A New Way of Life, a book I encourage you to read. And I'll go through a number of books today because I want you to gather information. I'm not the last word here. And what he's saying is, he quotes a study that breast, colon, and prostate cancer are not that common in Asian countries. In this country, they're about 7 to 60 times more common. And they checked the patient's cells and some at autopsies and found even at a young age they have a lot of the micro changes in Asia, but the true cancers never manifest themselves because they are not exposed to the toxins, the environment, the food, and the lack of exercise that we do, or smoking, some of them. And so the incidence is a lot less there. So they don't express themselves through our own genetics. Very interesting. And they also indicate that our genes maybe express 15% or so. And they studied that in twins. So it's unreasonable, I think, not to use the best of medicine. I want you to use the best of medicine, be fully informed, but it's also unreasonable not to try prevention techniques. 70-80% of the people don't participate in healthcare. They just do what the provider says, and they don't do reading. They don't. What I like to recommend is that you get fully informed in addition to whatever your provider provides, whatever you decide to do. Use some mind-body techniques, nutritional techniques to increase your chances of survival. They work. There's science behind this, and that's what this is going to be all about, because the environment, the diet, your psychological stresses, they all affect your immunity, and you really should have a look at it. And Stephen Gould, a very famous doctor who studied a lot about evolution, he developed cancer, a mesothelioma. And I'm not sure he's even exposed to asbestos, which is usually related to. Look at the statistics of chance of survival for himself, and you looked at the graph, and then and he had really an advanced form, and it was down to like he had a 1 or 2% chance of survival. But then he became fully informed, and read a lot and did the things that people recommend in nutrition and supplements, and guess what? He lived an additional 20 years and died of something else. What's the point? You're not a statistic. They can give you statistics, and you can tell you got a 10% chance, etc., but you're not a stat. That's just average figures. Don't put your mind to that and throw in the towel. The mind is important. Dean Ornish, very well known for his studies on the mind, the body, and heart disease, studied prostate cancer. And he found a very similar, if we eat a Western diet of fat, salt, and sugar versus a Mediterranean diet or more nutrient-dense diet like Dr. Joe Furman and myself speak about and practice stress reduction, self-acceptance, and exercise versus not doing those things, he found that the patients with breast cancer lived a lot longer. Some of the cancers are related to infections and bacteria, but not the majority of them. I mean, there's certain, like the papillomavirus, more likely to cause cervical cancer. Colorectal cancers are more common in people with inflamed bowels. But now we have excellent screening techniques, and be sure you know what the rules are about when you should be screened. You've got to be aware of that and get it done. Kaposi sarcoma is related to herpes, venereal disease, liver to hepatitis, smoking, with bronchial cancer, some malt lymphoma to Helicobacter bacteria, and asbestos to mesothelioma. So some are related to distinct toxins, viruses, bacteria in the environment, and you should, be aware of them. Stress is considered to be a cause of cancer, partly because you eat a lot you're trying to get a lot of sugar in to make yourself feel good because you're stressed. By type 2 diabetes, which can lead to, if you get a stressed belly, a pot belly, that fat generally is in the liver, causes diabetes. Diabetes has associated with a pretty good rate of increased cancer. If you're a woman, for example, even as a teenager, the increased insulin level from being overweight and insulin resistance caused by this fat in your belly or in your liver leads to increased rates of breast cancer. If you're overweight and you're a woman, you're a poster child, frankly, for breast cancer. And if there's family history of breast cancer in your family, you're really a poster child. So please pay attention, become informed, get to normal body mass index, exercise regularly, practice some of the dress techniques. Your chance of breast cancer is going to go down, and especially with family history. We send all our money to research, but very little to prevention. I'm about prevention. 50, 70% of cancer is due to poor environment, bad nutrition, lack of exercise. Don't you think we're to work on that? Most women don't know that. Most men don't know that. That's why I'm out here. I don't know why they don't know that. I recently read a very good book. I encourage you to read it, The Emperor of All Maladies. You can notice it's a very thick book, in over 500 pages. I read the whole thing. Gives a history of all cancers, and they mention prevention maybe 1/2 of one page. Yeah, and then they don't even tell you how to do it. That's kind of sad. It's from Harvard. Scientifically, I think it's a great book about when 50 to 70% of the cancers can be prevented. Why they don't have a major chapter on that is very sad. I haven't called the author yet, but I'm thinking about it. I still think it's a good book to read to learn about the scientific background of chemo, you know, and all these things. So stress increases inflammation in your body, which causes vascular disease and increased rates of cancer. Okay, the increased sugar, for example, if you're a type 2 diabetic, causes increased inflammation in your whole body. The insulin level causes cancer because it inflames the cells, and it has increased rates of cancer associated with the red meat, animal products, omega-6 fats. The bad fats have increased cancer rates because the animal that ate the food that's been genetically modified as full of inflammatory fats, omega-6 fats. There are good fats and bad fats. The omega-3s are the good fats. They're found in nature. Fat from nature is generally good. It's full of omega-6. Omega-6 is generally from animals. That way we've had who've been eating products that have been genetically modified, and then we eat. If we eat the animal, ate the bad food, well, that's what we are eating. If you eat fish from a pond full of inflammatory factors, well, that's what's going to do to your body. Dairy has been found to be quite carcinogenic. That's been well studied, and that's especially so since around 1950, when the cows, for example, stopped eating generally grass, organic grass, and now they put them on, inside of a barn, and they're feeding them genetically modified corns and fatten them up, and in essence put them in a cage. They're not grazing, they're not exercising, they're adding hormones to increase milk production 10 times. Oh yeah, cows that are locked up now increase production 10 times. They give them hormones to cause them to increase milk production, and that's what you're giving to your child. Eat Whitewash by Dr. Keon, and find out for yourself. Don't just believe me. Whitewash by Keon. So the casein in milk is carcinogenic. That's why we're seeing increased rates of cancer in children. Yeah, cancer rates in children have gone up significantly. You might say, like breast cancer, is because we have better testing. That's wrong. That's wrong. Because we changed the milk. Okay? And if we had better testing for breast cancer, at least, then we wouldn't have increased rates in children. If you menstruate before age 12, for every year before that you start, say, age 9 or 10, you increase the cancer rate 7% per 1 year. So the longer you're exposed to estrogen at the beginning or at the end of menopause, the cancer rates for breast cancer increase. Women need to be informed about that. Okay? People who are angry, under despair, hopelessness, more commonly get cancer. But if you're eating a nutrient-dense diet full of vitamins, minerals, phytochemicals, it is the interaction, the symphony of the interaction, the rainbow, the symphony of interaction that lead to good health. Cancer is about genes, and genes are affected by what you eat. Read a book called Deep Nutrition by Shanahan, and that will tell you how the information in vegetables affects the information that is in your genetic structure. So if you're eating bad food, it'll change you genetically. If you're eating good food, high nutrient-dense food will cause apoptosis. Cells that should die do die. It'll return cells that have had cancerous changes, help return them to normal. It will reduce inflammation. Reducing stress reduces inflammation. And also, omega-6 fats will cause angiogenesis. All tumors need blood supply. So if you're eating the foods that increase the blood supply to a tumor, of course, you're going to get worse. Anti-angiogenesis foods too, to reduce angiogenesis, are mushrooms and teas and herbs and cruciferous vegetables. Those are vegetables that as a flower or like crosses, like cucumbers, like broccoli, like cabbage. Those are cruciferous vegetables. They're anti-cancer, very healthy, and lead to healthy lifestyle. So rates of cancer actually are increasing. They projected on CNN the other day that breast cancer was going to go up 50% by 2030. Why is that? They didn't give a reason, but you and I know, I think we know what the reason, because we're unhealthy. We're eating the wrong food, where our body mass index is higher than that it should be. Remember, you're a poster child for breast cancer if you're overweight, okay? And children's cancers have increased a great deal since 1970, 2004. It was published in Lancet magazine, and that, you see, cannot be related to better testing, okay? And we don't do screening for pancreatic cancer, lung cancer, testicular cancer, some lymphatic cancers, brain tumors, and their stats are increasing. So it's not a statistical thing. There's something occurring in our environment, our lifestyle, that's leading to the increase. Also, the BRCA1, BRCA2 gene we find have high rates of breast cancer, genetic, but that was known a long time ago. But the rate of cancer from people who have that gene has tripled. So it's the exposure of that patient with that genetic change to their environment that's tripling the rate of that cancer. Charles de Gaulle from France, maybe the president of France, in 1964, formed an organization, the IARC organization, and they've kept statistics on world cancer rates throughout the world, and so has the World Health Organization. So they keep very close track of this and find that the Western world has had a great increase in cancers compared to the rest of the world. The environment, what we're eating, and our exercise habit, the thinking. And what they found in China, which is kind of interesting, in Hong Kong, part of China, where they have the same genetics, guess what happened? The cancer rates in Hong Kong among the Chinese have tripled compared to the mainland. What's the difference? What they're eating, their exercise habit, the stresses of their work or whatever. And so the head of the World Health Organization stated, this from him, not from me, 80% of cancer, lifestyle. In a way it's sad, but you know what it says to me? Opportunity, opportunity, opportunity. So the money shouldn't just go for research, it should go for teaching people lifestyle, exercise, free memberships. For example, an exercise place, but most people don't exercise, but to teach them how to eat the right food. No diet. I teach nutrient density. If you eat nutrient-dense way, and I will talk more about it later, you will bring the weight down. You don't have to diet. You got to eat the right food. 80% vegetables, perhaps 20% meat products, say something like that. And the way Dr. Furman teaches, the way I teach it, you're gonna lose weight. Your metabolism goes up. Your rates of heart disease, lung disease, diabetes all go down. Cancer rates go down. Read Disease Proof by David Katz. And on the cover of his book, 35 years, the biggest public health official in the nation, he says 60% of cancer is avoidable. It's higher than that, but he left it at 60. 80% of vascular disease, 93% of type 2 diabetes, where the insulin level is too low and too high, based largely on your BMI being too high, is totally preventable, depending on what you put on your fingers, your forks, and how you use your feet. What a wonderful, hopeful statistic. So just to turn this all over to radiation operations and chemo doesn't seem appropriate. We need that. I totally believe in that. But we need to teach prevention big time, and we're not. You read the paper the other day, $80 million to a new cancer center. Did it say anything? Did it say anything about prevention? Maybe opening up $1 million prevention center. Didn't say a word, okay? All right? So gastric cancer is going to way down because we have less of exposure to toxins like nitrates. We now have refrigeration. So things can change, and they do change. A lot of children's cancers with chemo, high number, are curable. So we believe in the lifestyle, but then again, should a child be drinking milk, at least we ought to really, really look into it closer. Drinking milk when that's carcinogenic, and children's cancers are increasing. Although cure rate with chemo has gone up, but why should they have it in the first place? Those kids suffer. Ever see a child with cancer? No hair, got an IV running, many of them look sick. That could be avoided. Don't you think we should stress that? Mothers need to read Whitewash by Keon and look at some websites, become fully informed. A lot of the literature states now that we have increased rates since 1904 because we have a high sugar diet. Sugar is inflammatory, and it increases the insulin level. Insulin causes cancer, inflammation, and we're eating much more animal products, and they're raised differently. We used to eat animal products off a farm, a real farm, but now they get fed genetically modified corn, put them in a cage, use pesticides and herbicides less than 50 days, and we fatten them up, and then we eat them. They're full of omega-6 inflammatory factors. That could be avoided. So exposure to vegetable oils, that's genetic, that are oils that have been heated, they're hydrogenated, they cause increased rates of cancer. Frying foods causes increased rates of cancer. Cancer is a sugar feeder. It's a sugar feeder. It loves to eat on sugar. It doesn't even need insulin most of the time to get the sugar into the cell. So the increased insulin level secretes IGF-1, which causes cancer to grow. So it's IGF-1 and glycosylation. If they want to demonstrate whether you have cancer spread all over the body, you know what they do? A PET scan, where they take sugar and an isotope. And when everything lights up, it's the cancer feeding on your sugar that may demonstrate, and I hope it doesn't demonstrate, cancer spread all over your body. If you're diabetic, and most of that is related to weight, increased BMI, 25% not, but 75% is, it increases the breast cancer rate 7 times. 7 times. Rarely do I speak to a woman that knows that. Rarely do I speak to a woman that knows that breast cancer is much higher if you're overweight, and even much higher if there's in your family history. Prostate cancer rates in type 2 diabetes increase 9 times. 9 times. People need to know that. So the much high increased rate of cancer related to diabetes. And I already mentioned about the milk changes occurred since 1950, depending on how we changed how we get the milk. Okay, and the grass that the cow ate was full of omega-3, the good fats. Now the cow is fed fats in the barn, and they're eating out of a trough and making omega-6, the bad fats. Okay, and now we like to eat a ratio of 1-to-1, omega-3 to omega-6. We need some omega-6. There's some fats in every cell in your body, so some fats are needed. Every cell, your 70 trillion cells, has some fat in it. Alpha-linolenic acid would be the best fat to have. That's what, through photosynthesis, picks up the energy of the universe. So you need some fats. But the ratio of us, instead of 1-to-1, we're running about 1-to-15, 1-to-20 omega-3, omega-6s. So we're eating a lot of pro-inflammatory fats. So sugar is pro-inflammatory, bad fats are pro-inflammatory, but sugar is the king. Sugar is the king cause of cancer and diabetes. If you were to look at a graph of toxins in the universe we're exposed to, it's frightening. They check the blood of the umbilical cord of children and find they have about 200 foreign chemicals in the umbilical cord, okay? what the mother and father put on their fingers and forks and what they ate, and their parents and their grandparents before, through epigenetics, can modify their gene structure through the telomeres on your genes. Telomeres are extension of your chromosomes, and you think you're born with your genes, you can't change them. Wrong. We can modify 90% of our genetic structures, which give us they run the activity of protein production through RNA of our proteins, okay? 90% or so. So whether the parents smoke, what they were exposed to, whether they exercise or not, what they ate, mom and dad, their parents and their grandparents, back about 2 generations, affect that little child in the placenta that is born. And then what we feed the child affects their genetic structure. And that determines who develops cancer in the future. Like even from smoking, breast cancer, the initial changes in the genetic structure occurred decades before most of the time. They can occur as a teenager for breast cancer. The same with smoking, and then they express themselves later on by an environmental trigger, perhaps nutrition, some more toxins, continuing to smoke, lack of exercise, lack of nutrients in their diet, and the cancer expresses itself. So what we do for decades determines our cancer rate. I'm worried about soy. You wonder about soy. Non-processed soy generally is anti-angiogenic. Okay, processed soy can be the opposite. Soy products are okay. Onions and mushrooms are the kings of nutrition to prevent breast cancer. Onions and mushrooms, a woman should eat a slice of fresh mushrooms every day, and a cooked mushrooms, because mushrooms have some poisons in them, and you should cook the mushrooms, and that's a very healthy thing to do. Let's speak a minute here about the mind, the influence of the mind. A number of great books have been written over the years about that, and very little attention is paid to that. Hutchinegger wrote a book called The Will to Live. That's important. If we just say, you know, well, what are my chances of living? And they say, well, most of them are dead in 6 months. Well, you'll be dead in 6 months. If people believe that, because their thought process can affect their immune cells. Candace Pert wrote a book, 1972, Molecules of Emotion, a great book to read. And she's saying, she was at Georgetown where I took my residency in neurosurgery, that neuropeptides, hormones, neurotransmitters from your brain, okay, by your thought process, land on receptors on your 70 trillion cells in the rest of your body and send messages to your cells. She's the first person to describe that. The first one she described was the opiate receptor site where morphine worked. She should have got a Nobel Prize for that. 1972, great book to read. She then discovered that the monocytes, your Army, Navy, Air Force, that defends your body, okay, your immune system makes the same neuropeptides, neurotransmitters, and hormones, and they speak back to you. Also, that nerves from the brain go to the spleen, which makes your immune cells. They've been demonstrated. I've seen them on slides. So your autonomic nervous system, your stressor, the adrenalines, or relaxer, acetylcholine, also send their neurotransmitters to your immune system, your Army, Navy, and Air Force. That is your defender. That is your defender. So how you think, whether you're stressed, whether you're positive or you're negative, whether you're hopeless, going to affect your lifespan. If you think you're going to die in 6 months, odds are pretty high. You become a positive thinker. You exercise properly. Use meditation techniques, breathing techniques, which are described in some of these good books, which I'll hold up to you, have an influence. Dr. LeShan wrote a book. Here's a great book to read. And Lawrence LeShan. Let me give you an example. He lived down the street from me in New York City when I was a child. I never met him. It's just that I read him here. I lived 3 blocks from the Metropolitan Museum of Art, and I thought I was poor. That was a mistake. He would walk a woman with metastasis from breast cancer spread all over her body. He would walk her through the museum once a month, take her to lunch, then he walked for her to look at her favorite art. He did it for 5 years. He restudied her in 5 years, no cancer found. Does that prove anything? No, it doesn't. But it sure gives you an idea, doesn't it? Well, he turned right around, studied 150 people, I think got up to 500 eventually with advanced cancer. And he found a tremendous effects of the mind on cancer. Negative thinkers as children, people from distressed homes, for example, had much higher rates of cancer years later. He studied a great deal about that and published a great deal of that, and that's in that book. Dr. Joel Fuhrman also wrote a book called Super Immunity. He's published many great books on eating properly, and he stresses the immune system and the essential nutrient guide for boosting your body's defenses to live longer, stronger, and disease-free. Great book to read. I've read it a number of times. A London physician studied breast cancer and found before age 50 no great value in screening. I didn't say don't get screened before age 50, but he studied it, found no great benefit, maybe to 0.2% of the people. After age 50, much more important. Remember, about 225,000 people in this country develop breast cancer every year, okay? 70,000 develop uterine cancer and 30,000 ovarian cancer. That's important for you to know. I mean, it's my opinion that if we properly educated these 300,000 people in proper nutrition, in exercise, positive thinking, mind-body techniques, we could probably have prevented 200,000 of them. I believe it. I believe it. But NIH, CDC, they don't want to spend any money in studying this in great detail, and that's a mistake because it'd save a lot of money. And look at the suffering they would save. And about 85% of uterine cancer is curable. That's good to know. Okay, and like I said, 90% of breast cancer probably is curable eventually, but you got to go through the radiation, through the surgery, through the chemo. And someone published a study that said that the lifespan is cut back about 19 years. I read it. I assume that's true for it, but you don't know. But that's interesting to read. Ovarian cancer is much tougher to treat because it's late in the diagnosis. 75% of uterine cancer is related to being overweight. 75% of uterine cancer could be prevented if we taught women about proper lifestyle, get their body mass index under control, avoid smoking, cigarettes, drug. Interesting. Do I speak to a woman that ever knows that? I couldn't even think of one. And this was confirmed by me by a cancer specialist that I met in the elevator the other day. It said, yeah, 75% or more of uterine cancer is related to being overweight. Interesting. We can run blood tests on people, and some tests now can be used as markers. You know, for ovarian and uterine cancer, CEA enzyme, colon and breast, lung and pancreatic cancer, they don't also can use a CEA enzyme. For breast cancer, CA enzyme 15 is called AFP for liver and testicular cancer, HCG for ovarian and lung cancer, Pap smears for cervical cancer, uterine cancer, PSA test for prostate, serum protein electrophoresis for myeloma. So we do have some blood tests for screening, and I encourage you highly to become fully informed about all these screening tests and to get your PSA and your ultrasounds and mammograms at the proper age and time, and listen to your provider. Get these tests. I'm just throwing out some statistics there. And the reason high-dense nutrient food helps you prevent and even if you have cancer, to change the way you eat, like the probiotic diet you read about it. And high nutrient dense way of eating, because they have in them enzymes that cause oxidation and get rid of the free radicals. Oxygen and sugar combine and release free radicals. You need it for ATP, so you got to have a certain amount of free radicals to live. They're made into energy, okay, in the Krebs cycle. But extra free radicals will try to steal an electron. It tries to make itself whole. So it steals an electron for another molecule and exposes that, and that's what leads to inflammation in the body and increased rates of cancer. The free radical theory of aging and cancer. Okay, so nutrient-dense foods are get rid of free radicals. Okay, they reduce oxidation. Okay, and there are a few supplements that are of value. I don't recommend necessarily a lot of them, but you hear about turmeric and curcumin. Whenever you read the literature, I mean, almost everybody recommends that. So put that in some juicing or smoothie, add some turmeric and curcumin, read about it a little bit. You use the powder, some use the pills, some use the plant. Put it in your smoothie. I take some of that every day. I don't take many supplements, but that's one I do as a preventative because it's anti-inflammatory. It helps reduce colds. My friend Dr. O'Rourke, a pediatrician, never gets a cold. And I think he and his wife take curcumin every day, and they recommend it to their patients. Their patients have much less colds. Very interesting. And he teaches them to eat the nutrient-dense way, and he does too. So, you know, that's certainly part of it. So we must participate in our health care. I think this is very important. Another book I recommend you to read is Beating Cancer with Nutrition by, this is very good, Patrick Quillen. It's an excellent book. Excellent book to read. I've read it probably 5 times. It explains some of the science of it in simple terms, has even some recipes in there, which are very important. So what nutrients are the best in prevention and healing of cancer? Let's go over that a little bit. And there's a good website called Nutritional Facts run by Mike Greger, G-R-E-G-E-R. It's free. He reviews the world literature on nutrition. And I watched a review actually on cancer the other day. He sends you a free email. This guy, to me, is just fantastic. And I think he's paid actually by the Animal Society because they feel there will be more animals alive if you eat right. But he's an honest guy. He just takes the research literature in the world. I've met him, among the best. See, these vitamins and minerals, phytochemicals are full of chemicals that cause healing. Okay, the 2 best, he says, is allium plants like garlic, onions, and leeks. Remember, I spoke about eating a slice of onion. Okay, spinach and beets among the stars. Spinach and beets among the stars. It reduces even brain tumor rates. Being a brain surgeon, I haven't seen some malignant stuff over the years. Reduces brain tumor rates, kidney tumors, breast cancer. Radicchio, a plant, is excellent for breast cancer if it comes back or prevention. Excellent. And so it's the interaction is best. Not to necessarily take it as a supplement. Take it in the original plant. It's the symphony, the rainbow, the music of interaction that leads to good health. Let's start the music. Okay. Let me go down the list here a little bit, and let me start with the best. They're all good. Okay. Garlic, leeks, green onions, yellow onions, Brussels sprouts, cauliflower, curly cabbage, broccoli, radicchios, rutabagas, kale. There's a good one, full of phytochemicals and nutrients. Furman would call it number 1 on his score of nutrient density, his ORAC scores. He gives kale 1,000, white bread a 10. Okay, you get the idea. And spinach, radishes, eggplant, bok choy. These are great vegetables to eat. A lot of them are cruciferous vegetables, some are alliums, and very healthy. You want a healthy life, eat a lot of those. You'll avoid heart disease, strokes, and rates of cancer will go down. And if you have metastatic cancer now, eat some of those. They'll increase your chance of living. Learn about mind-body techniques, for example, if you have metastatic cancer. That'll increase your chance of living. And we'll speak some more about them. So garlic is actually the best of them all. Eat some nuts every day, Dr. Furman would say also, because they're full of good fats, phytochemicals, and fiber. And so let's go back to the power of the mind a little more, okay? Candace Pert's book, The Molecules of Emotion. Remember I told you to read that. And how does the brain speak to the body? We talked about that, hormones, neurotransmitters, neuropeptides. So how you think can decrease or increase your immunity. It definitely can. If you give the patient no hope, if you have no hope, your odds of dying increase greatly. Well published, LaShan, full of this book, and many other. Getting Well Again by Symington is a great book to read. Here's another one, Bernie Siegel, Love, Medicine, and Miracles. Great book to read. These things are important. I've saw it many times. I had a patient years ago with a malignant brain tumor from Huntington. He came in, he told me, Dr. K, I'm not going to die. You know what happened? He never died of a highly malignant brain tumor. What do you say? What do you say to that? He died 10 years later or so from something else altogether. I saw the scan. Positive thinking. It was as positive. Every time he came in the office, he was into it. He sure as heck was going to the right doctor. I helped him. His wife was involved too. It never would have happened without the wonderful wife that he had. So the brain speaks to the body. Gershan wrote a book that the gut is the second brain because of the hormones, neurotransmitters that are made in the gut. Your Army, Navy, Air Force, your immune system is 40% in your gut. It's just one layer below your mucosa that's trying to catch every enemy that might be invading your body through food, for example, or bacteria. So you need to get your immune system going, okay? And increase the power of positive thinking. Norman Vincent Peale wrote and you can if you think you can. Power of positive thinking. Visualization is a big one. If you can visualize something, it's more likely to happen. Your brain is more likely to get the message. If you're trying to memorize something, visualize it. All golfers, tennis players, we all know that. They even teach a form of meditation where and I had a patient do it once. He had a tumor sitting here this size, and I'm not saying this is a scientific study. I'm just telling you what happened. 35 years old, metastatic lung cancer from smoking. Don't smoke, please. He had a tumor sitting here, and it looked pretty hopeless to me, but I did not project hopelessness to him, okay? I gave a message of hope to him. And I taught him visualization. It was in October, and I told him, first of all, I told him on July 4th, next year, he's a fisherman from Syracuse, that I was going to have lunch with him at 2 p.m. on a Sunday, July 4th, at Lake Wabaunsee. He knew the lake. And I asked him to visualize that every day. Okay. Then I asked him to visualize that a Pac-Man had entered his body through a vein and was in there eating up all the cancer cells, and that he was urinating them out. And I asked him to visualize that every day, twice a day. I don't know 100% how many times he did it, but I'll tell you this. July 4th, the next year at 2 p.m., he showed up for lunch on the head of my pier at Lake Wabaunsee. And then he told me something which almost would get you excited or mad, depending how you look at it. The 4 big bass he held up, he caught under my pier. And I fished all day and caught nothing. Okay? I think he got up early. What a wonderful story. That's not scientific proof. But if you read these books, I'm recommending to you, a lot of stories like that in there. So let's not throw in the towel if you have an advanced problem. So that's meditation through visualization. Remember, I already told you, through neuropeptides, hormones, through nerves, you can speak to your immune system. Candace proved that. So be a positive thinker. Don't throw in the towel. I'm not going to die. That's the words I want to hear. And Hippocrates, you know, thousands of years ago, you know what he said? He would rather know what sort of a person has the disease than a disease the person has. Interesting. Galen said it. Hippocrates said it. Osler said it at the turn of the century. Pasteur said it, the one who the discoverer of information in bacteria and viruses says, and on his deathbed he said, because he had an argument going all the time with the other doctors about whether it's the specific chemical or the specific bacteria, and Pasteur said, it's the soil. In other words, it's our environment in our body that is more important than what's affecting it. So we need to create a good soil in the body through proper nutrition, through proper lifestyle, through proper exercise. 80% of the people out there, unfortunately, just say operate and don't participate. They don't develop other knowledge. Did I say I was against surgery, against chemo? No. Get everything that you feel that you need. Get other opinions, okay? Other cancer centers if you need to. The doctors are great around here. They might even suggest other opinions. But please participate in your health care. Develop some knowledge like you're doing today, watching me here. So only about 20% want to participate. Unfortunately, I hear from the diabetic department, the doctors I work at, only 50% of the patients participate in the health care in the diabetic clinic. How sad when 90% of type 2 diabetes can be eliminated through lifestyle and proper nutrition. I give a lecture on that frequently. I'm very, very familiar with that. Bernie Siegel wrote that book called Love, Medicine, and Miracles. I showed it to you already. So our mind, you can see now through these chemicals, can affect our endocrine and immune system. We make 50 hormones in our body. Can you imagine their interaction? And when we can, with our thought process, can use our neurotransmitters, hormones, neuropeptides, and affect our endocrine system, affect our whole receptors on our cells, and we throw in the towel on our own mind, give me a break. Give me a break. Give yourself some help. We have 50 hormones, billions of antibodies to defend us, our Army and Navy, neurotransmitters, trillions, hormones, millions, neuropeptides, millions in our nerves, in our autonomic and sympathetic nervous system that all affect what goes on in our body. So to throw in the towel on that seems quite inappropriate. Okay? So I have a peaceful mind. I have a message of life. Okay? Remember Norman Vincent Peale in New York said, remove the word impossible from your life. I visited a church in New York, incidentally. And he wrote a book also called You Can If You Think You Can. Wonderful books to read, about 20 books. One of his assistant ministers gave me all the books one year because I was treating a relative of his. Unbelievable books. I still have them at home, signed by Norman Vincent Peale. Many people have not heard of him, but you know, a few years back, 50s, 60s, he was around. And so Carl Symington, you know, speaks a lot about imaging and visualization and using, perhaps establishing even in your own mind. Herb Benson, you know, said there's a doctor living within us. Just think about it. Just think about it. You get a cut, unless you need stitches, somebody they're going to repair it, and your body will repair it. So that goes on in your body all the time. It's called a surveillance theory of cancer, that we make some cancer cells every day. We make some every day, except immunity kills them. Okay? It just, when 90% of the time, if something's out of hand, we're smoking or drugs, or we don't exercise and turn of our genetic structure, that cancer takes over, okay? Or negative thinkers, for example. So you can affect the rate. So the will to live is very important. And depression is a surrender to death. Sometimes it's hard not to become depressed when you're facing the situation, maybe your social problems, your children, your family, and you're young, for example. But don't surrender to it. Don't throw in the towel. Start reading and participate in your health care. There are miraculous cures. They happen. No one knows for certain why they happen, but what happens is the immunity changed. The immunity changed. And they studied them carefully. And a lot of those people have been people who participate in their health care. And so Freud said we have a creative, the famous psychiatrist, or destructive instinct within us. As you're getting a day older, where cancer rates increase, to be a positive thinker and have a purpose in life is preventative of chronic illness. Yes, and decreased rates of cancer. So keep a purpose in life. Helping other people is the easiest and best purpose. I feel fortunate. I have a purpose. I spend all my day and night on it, writing on CDs, DVDs, websites. As I feel so lucky. But develop a purpose. It doesn't have to be anything big, but develop some purpose. You'll be a lot healthier. Look at Christopher Reeve. He dies, and the paralyzed gentleman, you know, who fell off a horse, his wife dies within 9 months. Never smoked, and that's not proof, but maybe negative thinking was it. Stress, depression. Would you blame her? I wouldn't blame her. All she went through, taking care of him all these years, we ought to give her a medal, frankly. And but you wonder that her immunity went down because of stress. LeShan would say we only die when we're ready to die, okay? So develop a purpose in life, okay? I think that's important. Ask yourself, what kind of life would I like to lead? Sometimes we develop cancer, now we have a reason to do the things that maybe that we had no opportunity to before if you financially can. You know, you want to do this, you want to become a missionary. That's happened plenty of times. Where someone just said, I'm going to be a missionary in some foreign land, leaving with metastatic cancer, and 20 years later he comes out of the woods and finds he's cured. There's stories like that out there, okay? So hopefulness and love are important. Creativity, create to survive, okay? Find your music in life. Find your music, because your music will speak to your immune system and get it going, fighting for you. Okay, so find your music. Okay, so so get rid of hopelessness, get rid of depression. And sometimes hopelessness and depression precede cancer, before it even happened. Remember, LeShan said, when he studied the background of a lot of people with cancer, he found hopelessness, depression, and problems in their background, not just the environment. And the despair led to cancer later in life. So the zest for life is critical, okay? So you need to re-engineer your body. Developing a purpose is a great thing. Medicine uses a lot. I wrote a book on it called Nocebo, the Evil Twin. That's the opposite of placebo. So providers, unfortunately, and different ones, you know, some don't do this at all, obviously, will be negative speaker and say only, you know, how long get to live. And I know of a case like that. Actually, it was a brain tumor in that group. One of the doctors came to me and said, you know, Rudy, I think I know what you're talking about. 35 years old, 5 kids, had a seizure and had a small malignant tumor there, and that neurosurgeon spoke to her, and how long get to live? He says, well, about 6 months. He should have said 6 months, or maybe 10% do better if we do the following things. There is some hope. Give her a hug, and I'll do everything I can to help you to get you into that 10%. That should have been the conversation. She started screaming. She never did stop screaming. Then he does a biopsy the next day, tells the same message. 2 days later, tiny tumor, size of a quarter, she was dead. Yeah. What happened? Neurofibrillary degeneration of the heart, pulmonary hypertension from negative thinking, and she died. That's the voodoo effect. That, in essence, is the voodoo effect. And that's been well described. So negative thinking can really be a problem. What I'm saying is a human being is more than the sum of their specialists. Okay? You are more. You're not just a statistic. Okay? You are more than the sum of your specialists. But you must participate in your health care or you're not. You must read. You must do some of the things. You can't just look at your lifestyle, maybe look at your BMI, and have a history of cancer throughout your family. Say, well, it's just my genes. No, it's the expression of your genes. If there's a lot of breast cancer in your family, for example, and you're weighing a couple 100 pounds, you're a poster child for breast cancer. Poster child. Get rid of it. Get rid of it. Get rid of it. Get rid of it. Start working out. Start reading some of these books. Eat a nutrient-dense diet. Eat to Live. Dr. Furman is a great book. Secret of the Non-Diet, a book I wrote. I think it's a pretty good book. And start visualizing yourself in the mirror, that you're going to get in great shape, and your odds of breast cancer are going to go down. Okay? They're going to go down. So proper eating, exercise, thinking positively, developing a purpose in life are all very critical. I think in going through this, see, Descartes, a very famous, 1635, kept the head of the body and gave it to the church, and we gave the body to science, and we've been treating people like they don't have a brain, that the thought process that is not involved with us. So this was a mistake. This was a mistake. Descartes' Error is a famous book, actually. And bring in spirituality. That's important. Belief and spirituality, I think, are very important in healing. Maybe use visualization. You're getting well. Maybe you have that Pac-Man coming and getting rid of your disease process. But belief in God, your God, not my God, your God, I think is very important in the healing process. I think prayer has value. And so in summary, what I'm saying is we can prevent 50 to 80% of cancers by a proper lifestyle, nutrition, what we eat being most important, exercising regularly, then bringing in the human mind, positive thinking through our neurotransmitters and our hormones, and then bringing in spirituality. You could be a lot more hopeful, and your prevention and cure rate of cancer will go up. Follow us in our other lectures where we connect the mind to the body, look at websites, read a lot, and become hopeful, develop a positive thinker, and this will be on Public Access TV, I think probably next Wednesday at 6, and after that it'll be on YouTube. And join us in our lecture series at the Lufin Hospital on a regular basis. We do this because we love you and care about you. Send me a book, I'll review it with you, whatever. Thanks again for watching.